Hi, my name is Louis Tornes. I'm a agency owner of LTDT Insurance, and I'd like to welcome you to April 2020 Medicare Scholar Program. This month's topic is Original Medicare versus Medicare Advantage. And we'll be talking about your choices, your enrollments, coverage, networks, billing, some extras, prescription coverage, and I'm very excited about some of the upcoming changes. So first, let's talk about your choices. When you first become Medicare eligible, you are part of the Original Medicare. With Original Medicare, you will have Parts A and Parts B. And then you have to choose from a Part D program. And at this point, I'd like to add, you can get a supplement plan with Original Medicare. Choice 2, however, is the Medicare Advantage. And this usually has all of Part A and Part B, and usually has Part D included, plus some extras. So let's talk about the enrollment for Original Medicare. This is for people 65 years or older, or under 65 with certain disabilities, including ALS and end-stage renal disease. Now, for 65-year-old, there is what's called an initial enrollment period, which is 3 months before, the month of, and 3 months after your 65th birthday. During this time, you can enroll in a Medicare. However, if you miss this period, you would have to wait for the general enrollment period, which would be between January 1st and March 31st of every year. And if you do go this route, your plan will not start, or your Medicare will not start till July of that same year. Now, you can delay your enrollment to Medicare at age 65, and that is if you have work insurance. In other words, you must be covered by your employer or union group based on your or your spouse's employment. So if either one of you have insurance work and you're still working, you can delay the Medicare to that point. As soon as you stop working, there is an 8-month special enrollment period, which it occurs whether you leave the job or the coverage end, whichever one happens first. To enroll in a Medicare Advantage plan, you must have both Parts A and Parts B to join, and must continue paying your Part B premium. Your initial enrollment period starts 3 months prior, the month of, and 3 months after your 65th birthday, and again, you must have Parts A and Part B. There is an annual election period that runs yearly, and that's from October 15th through December 7th. These plans during this election period will start on January 1st. And then there are open enrollment periods, and those happen yearly, and they're from January 1st through March 31st. You can change from a Medicare Advantage to another Medicare Advantage, or you can go from a Medicare Advantage back to Original Medicare during this time. Either way, the change would be effective the first of the following month. For example, if you do a change on February 15th, it will go into effect on March 1st. Additionally, there are special enrollment periods for everyone. A good example is changes in your residence, if you move from one county to another or from one state to another. Loss of group coverage. Gain, maintain, or lose Medicaid or extra help. Enter in, reside, or leaving a nursing facility. Those are all special elections, and there are many, many others. Please consult with your insurance agent for more information. Now we're going to talk about coverage. Start off with Original Medicare and Part A, as known as facility coverage, better known as hospitalization coverage. For the first 60 days that you are there, you will pay a deductible of $1,408. The benefit period, like I said, is 60 days. Let me explain how this works. If you go into the hospital and you're in there for 3 days, you would pay $1,408 for that benefit period. If you go back into the hospital, let's say 30 days later, and you're still within the 60-day period, you don't have to worry about it. However, if you go there like 2-3 months after and you've passed that 60 days, you would pay another deductible of $1,408. Now, if you're in the hospital and you stay those 60 days, there is no copayment. That deductible will cover that time. However, if you stay over 60 days, in other words, from days 61 through 90, you will pay an additional $352 per day for the hospitalization coverage. And if you're really sick and you need more time and you spend from 91 days and beyond, you're going to pay $704 for each day, up to 60 days. And this is what we call a lifetime reserve. So once you use this, you lose the time. So if you use, let's say 100 days, you still have an additional 20 days, or excuse me, additional 10 days, and you can use 10 more days in your reserve. And beyond that time, you pay all cost of the hospitalization. On the Part B side, known as medical coverage, this is where your doctors and your testing and just about anything in Medicare Part A doesn't cover when it comes to medical coverage. You will have a deductible of $198 per calendar year, which starts January 1st. First visit, you will pay up to $198 until you do get to that, and then you get the famous 80-20 split, and where you would pay 20% of the Medicare approved amount. Now keep in mind, very important, there is no maximum out-of-pocket limits with original Medicare. So 20% could be whatever it comes up to, and that's what you have to pay. Coverage for Medicare Advantages work a little different. Co-pays and co-insurances for services are set by the carriers. Now, co-pays are a set amount for a specific service, such as $10 for an office visit, there would be a copay. It's a set amount of money that you pay. $300 for inpatient service or a hospital service. Where co-insurance is a percentage for a specific service. For example, they may want to charge 20% for outpatient surgery. It's based on the carrier's contract amounts for each one of these services. One of the things I like about Medicare Advantage plans is they have what's called a maximum out of pocket, otherwise known as MOOP. And this is basically a limit of how much you can spend out of your pocket. It would include all co-pays and co-insurances for your Part A and B coverage. And the highest allowed MOOP plan this year for 2020 is $6,700 for an in-network amount. Out-of-network is higher. Keep in mind also that some plans may offer a lower maximum out-of-pocket. Now let's talk about network. In original Medicare, you can visit any doctor, any hospital, any facility in the United States or any one of its territories that accepts Medicare. 93% of the doctors do accept Medicare. Over 5,300 hospitals accept Medicare. And to get a list of these doctors and hospitals and facilities, you can visit Medicare.gov and find providers or facilities that you might be interested in. Now let's talk about the networks in a Medicare Advantage plan. Now, the two most common ways of getting a Medicare Advantage plan, first one is what we know as a health maintenance organization, better known as an HMO. Here, you must see doctors within the network and facilities within the network. If you do go out of network, you're responsible for 100% of the costs. So there's no out-of-network coverage with an HMO. The exception, obviously, is in case of an emergency. Let's say you're outside of the area, or you need to see a doctor, or you get rushed to a hospital and it's an emergency, or an urgent care center, that would be treated in network. The other way that's most commonly used is what's called a preferred provider organization, or a PPO. Here, you would have lower costs to see doctors within the network and providers within the network. You can go outside of the network, but you will pay a higher copay or a higher coinsurance. Now, make sure if you go out of network with these PPOs that they must accept Medicare. Otherwise, you would be responsible 100%. Now let's talk about billing in original Medicare. If you go to a participating provider that accepts Medicare assigned numbers, he will bill the Medicare directly, and Medicare will pay the provider directly. If you go to a non-participating provider, the doctor will bill Medicare directly. However, Medicare will pay the beneficiary, and the beneficiary must pay the provider. And if you go to an excluded provider, which basically means he doesn't do any Medicare, the bills will go directly to the patient, and the patient is responsible for 100% of the bill. Medicare will not reimburse you for expenses for these doctors who are excluded, or facilities. The billing on Medicare Advantage plans a little easier. The provider bills Medicare Advantage plans. Medicare Advantage plans pay directly to the provider. And the only thing you have to worry about is paying the co-pays or the co-insurance. It's that easy. Let's talk about some of the extras. First, on original Medicare. When you first are eligible for a Medicare, you get what's called a Welcome to Medicare physical. This is done within the first 12 months of your Part B start date. You also get an annual wellness visit after your 12 months, and this is a yearly basis where you have one visit to the doctor for wellness. And finally, you have all the preventative services, and this is a partial list of some of the things that are provided there. Another one I like to usually add in here is flu shots. So there are some other things that you can get in here. There's about a big list of these preventative services. All these services are free of charge, and you should take advantage of this on original Medicare. Now on the Medicare Advantage side, some of the extras are as follows. Everything we just talked about on the Medicare, original Medicare, plus dental, vision, hearing, fitness, transportation, chiropractic, acupuncture, annual physicals, discharge meals, telemedicine, over-the-counter supplies, and much, much more. Now, not all plans do give you all these things. They do vary by plan, so make sure you check the plan, and they'll give you all the different benefits allowed. Finally, let's talk about prescription coverage. Under original Medicare, you must purchase a separate Part D plan. These are known as PDPs, or prescription drug plans. Under the Medicare Advantage, many of the plans include Part D coverage. These are designated as MAPDs, or Medicare Advantage with prescription drugs. For those few plans that do not have Part D coverage, you can purchase a standalone Part D. These are plans like a PFFS, pay for fee service, or maybe an HSA account, which will be new here in 2021 in the state of Florida. But these plans, you can purchase a separate Part D plan. As you can see, there are two main ways of getting your Medicare coverage. Stay with original Medicare, use your red, white, and blue card, or sign up with a Medicare Advantage plan. Which one's best doesn't, it really depends on the person. Every every situation is different. We're here to help you out. If you'd like to help in explaining the differences, even with more details, that's what we're here for. With some of the changes, as we talked, I know I just mentioned the HSA type of account that's coming up under Medicare Advantage. There are some other changes that will be coming in 2021. So one that I'm excited about and a long time coming is, I know originally we said if you have end-stage renal disease, you cannot get a Medicare Advantage. Well, starting in 2021, Medicare Advantage plans will start accepting these beneficiaries. So that's an exciting thing and help for these people that need it. Um, and like I said, initially these people were not allowed to get on a Medicare Advantage plan. So they were forced to stay with original Medicare and most of the times forced to pay for a Medicare supplement to help cut the cost for this terrible disease. Anyway, I appreciate everything. I hope you enjoyed this. I hope this is educational to you. Again, my name is Louis Tornes. Please feel free to reach out to me or one of my team members, and we'll be happy to come out and explain to you Medicare or any other things that you might need that has to do with your insurance needs. On behalf of Medicare Scholar and the program, and as a facilitator, I thank you for watching this video, and hopefully we can help you out in the further things. We will be producing this on a monthly basis, so we look forward to seeing you in May. You have a blessed day. Take care.